Hi, my name is Mindy Huntington Frazier, and I'm the Outreach Coordinator at the Olympic College Nursing Program. Thank you for joining me today for this virtual information session. During this video, we will review everything you need to know to apply to the Associates in Technical Arts Licensed Practical Nurse to Registered Nurse pathway. This is a bridge pathway for LPNs interested in becoming RNs. We use a selective admissions process, meaning you have to apply and be accepted to both Olympic College and the nursing program. We accept applications year-round, but we have one application deadline of August 31st each year. We admit roughly 10 students into the LPN to RN pathway. This pathway starts with one transition class that first winter quarter, followed by 4 full-time quarters. At the end, you graduate with an Associates in Technical Arts degree and are qualified to take the NCLEX, which is the state licensing exam. To apply, you'll need to have an active Washington State Practical Nurse license. You'll need to apply to Olympic College, complete the Reading Comprehension Accuplacer, complete the prerequisites and support courses, submit all official transcripts if you've completed classes outside of Olympic College, and complete and submit the LPN to RN application and all of the above materials by August 31st. The Accuplacer is a test used by many community colleges to determine placement for math and English classes. Based on your educational history, you may not need to take the entire Accuplacer exam, but all students applying to our program will need to take the Reading Comprehension Accuplacer. The minimum score to apply is 260 for the next generation Accuplacer, which is the current Accuplacer offered, or if you took the Accuplacer before 2019, an 84 on the classic Accuplacer. There are 6 required prerequisites for this program. All prerequisites must be completed by the application deadline of August 31st with a minimum GPA of 2.0. These prerequisites are English 101, which is a composition course, Psych 100, which is general psychology, Chem 121, Intro to Chemistry, Biology 241, Anatomy and Physiology Part 1, Biology 242, which is Anatomy and Physiology Part 2, and Biology 260, which is microbiology. This pathway also has some required and optional support courses. Support courses are not required before you start the program, but will help you prepare for your nursing classes and can help lighten the load if completed early. Before fall quarter, so sometime in winter, spring, or the summer at the latest, you must take a 5-credit elective from anthropology, communication studies, history, humanities, philosophy, political science, or sociology. It's also recommended to take a college level math, but this is optional. College level is any 100 level math or above, and most of our students take either Math 107 or Math 141. If you need to take your science classes at Olympic College, you do need to follow a specific sequence. The typical way people complete their science prerequisites are Math 99, which you can test out of through the Accuplacer math exam, Chem 121, Chem 131, which is not a prerequisite for the program, but is required to take Biology 241, which is Anatomy and Physiology Part 1, Biology 242, Anatomy and Physiology Part 2, and Biology 260, which is microbiology. If you have completed Anatomy and Physiology elsewhere, you do not need to take Chem 131 for entry into the nursing program. Sometimes people want to finish prerequisites as quickly as possible. You can technically take Biology 241 as a co-requisite of Chemistry 131 and Biology 260 with Biology 242. This, however, is not recommended, but it has been done. This leads to very intense 2 quarters and requires a lot of time due to the number of labs you'll be in. You may also be able to test out of Chem 131 through the testing center, but this is really rare. You can learn more about how to test out by visiting the website www.olympic.edu/chemistry. If you are transferring credits from another college, please supply all official transcripts from any institution you have attended since high school. Send transcripts directly to the admissions department along with the transfer credit evaluation form. Your transcripts won't automatically be evaluated, so it's really important you submit this form. You will also need to be an Olympic College student and enrolled in classes for the evaluators to review your credits. If you have taken biology or chemistry classes at an out-of-state college or at the Evergreen State College, you'll need to have a course review done. To do this, send our Health Pathways Student Success Coach, Ashley Blake, your unofficial transcript and course syllabus via email. Course syllabi are usually available from the division office at the college you attended. These documents are then sent to a member of the faculty in the appropriate department who will evaluate it against our classes to determine equivalency. Please allow 3 weeks for response. These are 2 separate processes, so I just really quickly want to recap. The transfer credit evaluation is for the entire college and determines transferability for general credit at the college. It must be requested once you're registered or applied to the program. Official transcripts and transcript request forms can be sent to evaluators at olympic.edu. The course review process is for the nursing program only and determines equivalencies for specific biology or chemistry classes taken either out of state or at the Evergreen State College. This can be done at any time prior to your application. To do this, you'll send class syllabus and unofficial transcripts to Ashley Blake at ablake@olympic.edu. Some additional credit-related details. You can retake your prerequisites up to 3 times, and we'll take the most recent attempt. The minimum GPA to be eligible is a 2.0. Hopefully you do better each time you attempt the class. Credits do not expire for a nursing program, so if you took anatomy and physiology 10 years ago and got a good grade, you don't have to retake it. And once your prerequisites are complete, you may apply for the program. If you're completing your last prerequisite during summer quarter, that's totally fine. You have 2 weeks after the application due date to submit your final official transcript. There's also a $35 application fee for first-time applicants. It's waived for your rollover candidates. Make sure you include your official Accuplacer reading comprehension scores and any transcripts and the transcript evaluation request form if applicable. Submit all documents before August 31st for a January start. To find the application for this pathway, just scroll down to below this video. Click the little caret next to LPN to RN application and instructions, and then select LPN to RN application. The LPN to RN application instructions are also very helpful, and I recommend you open those as well. Once all the applications are in, we review them according to the method listed on page 8 of your application instructions. We use a factor-based point system. All courses must be completed by August 31st to receive points. First, we take the cumulative GPA of all your prerequisites courses. That's English 101, Psych 100, Chem 121, Biology 241, Biology 242, and Biology 260. There are 6 points possible. And here's the breakdown of those points. I always like to point out that you don't have to get a 4.0 in all classes to get all 6 points. Your reading comprehension score also counts for points. You get 1 point for meeting that minimum requirement, and then 2 points if you score over 285 in the next generation version or over 106 in the classic version. You also receive an additional point for those support courses, and so in this case it's just that college level math. And then if you're a previous applicant, you can also receive an additional rollover point. First-time applicants can get 9 points, and second-time applicants can get a total of 10 points. Here's an example of a student who has high grades, note not all their prereqs are 4.0, has completed that math support course, and received at least the minimum score on the Accuplacer. This student has also applied before, so they get a rollover point and have a pretty competitive score of 9 out of 10 points. Student number 2 has grades that are a little bit lower, has not yet completed their college level math support course, and scored the minimum on the Accuplacer reading comprehension exam. This is also their first time applying, so they do not receive a rollover point. Their total factor points are 5 out of 10. There is no magic score to get into the nursing program. Some years it may be students with 9 points, other years not all 10s get in. It really depends on who else applies. We always recommend you put your best application forward. The Olympic College Nursing Program has 3 types of classes. We have theory classes, which are your traditional lecture and class activities. 1 theory credit equals 1 contact hour per week per credit. So a 3-credit course is 3 hours per week. We also have lab classes where you practice your skills on classmates as patients for non-invasive things like communication skills and blood pressures, and mannequins for more invasive things. And 1 lab credit equals 2 contact hours per week per credit. So 1 credit lab class is 2 hours per week. We also have clinicals where you're in a facility like a hospital or a skilled nursing facility where you're working with real patients. We also have simulations where you work on high-tech mannequins to learn those skills. And so here's an example of that. 1 credit clinical course is 2 contact hours per week per credit. So 5 credits equals 10 hours per week. We also like to point out that there is study time required. So for each hour in class, you'll need about 2 hours to study. The Olympic College Nursing Program does have a minimum grade required for each class. So for all your prerequisites, you must have a minimum 2.0 grade in every class. Once you're in the program, you must have a minimum 2.2 grade in every class. What happens if you don't achieve the required grade of 2.2 in the nursing class? You will have the option of petitioning the faculty to re-enter the program, and if successful, you join the cohort the next year. Unfortunately, if you fail a clinical course due to a safety concern, you will not be allowed to petition for readmission. Before you start clinicals, you'll need to submit some documentation. You'll need to have CPR, so basic life support for healthcare providers, malpractice and liability insurance, which is available through the cashier's office for about $25 per quarter. You'll need some sort of health insurance. There's a whole list of immunizations, and then we'll need to be able to do a background check. It is expected that you turn all these documents in on time and completed when asked for them. This is important as 1 late document can hold up the entire class. I also always like to note these things are not necessary to apply to the program, and it's actually better for you to wait until you hear if you're admitted to the program before starting to gather these items, as some of them are time sensitive. As a student nurse, you'll be using all of your skills and abilities. Some of the motor duties may include those listed here. Communication skills are very important for student nurses. You'll be communicating with a wide variety of people like instructors, classmates, patients, families, doctors, and other nurses. Your patients are sick, sometimes they're in pain, and may be scared. We use therapeutic communication to care for our patients. If you need to improve your communication skills, consider taking a communication studies course like interpersonal communication or public speaking. You will also need to have good emotional health as a student nurse. Nursing school can be stressful. Be aware of your coping mechanisms and support system, and know that you can always ask for help. You'll also be taught a professional code of ethics in nursing school and are expected to abide by it. If you have a disability, our Access Services Department can help by offering reasonable accommodations and working with your faculty on your behalf. We use a lot of technology in our program, including email to communicate with professors and classmates, word processing system like Microsoft Word or Google Docs for writing papers and studying. Use the internet, intranet, library, and database searches. This is for information gathering for client care, papers, assignment. We use our learning management system called Canvas. This is where all your class materials and lecture information, if there's any hybrid coursework, and some testing occurs. We'll also use electronic medical records for clinical documentation, and then simulations to develop clinical thinking. Items 5 and 6 you'll learn in the program, but if you're not familiar with items 1 through 4, it's highly recommended that you familiarize yourself with them before accepted into the nursing program. To help familiarize yourself with Canvas, General Studies 97 is offered. You can also take Nursing 102 every summer quarter to learn more about internet, intranet, library, and database searches. The NCLEX is a computer-based test. So to help our students get used to this style of test taking, we also use computer-based testing programs, ExamSoft and Exemplify. Students will need to bring a laptop to class to take exams. These programs work only with Mac and Windows operating systems, so it doesn't work with Chromebooks, Android, Linux, tablets, or other phones. Students can check out a laptop that meets these requirements from the IT help desk if needed. There are a few conditions that may occur during nursing school that you'll have to agree to if you accept admissions. Though our courses are typically during the weekday, there may be classes in the evening or weekends. Healthcare is a 24/7 operation. This means you may have clinical experiences day, evening, or night shift any day of the week, including the weekends. We try to keep clinical sites close to campus, but there's always a chance you may have to travel over 50 miles. And school needs to become your priority over work or other personal responsibilities. And we know life happens. It's okay if you realize that you cannot commit to these right now. If that's true for you, please don't accept your provisional offer to the program so we can offer it to someone else. Thank you so much for watching this virtual information session. Please consider registering for a live or not recorded information session for additional information on this pathway, especially if you have questions. We also encourage everyone to set up a meeting with our Healthcare Pathway Student Success Coach, Ashley Blake. Ashley can help do an unofficial review of your transcripts and build out an education plan to help you get to where you want to go. If you have previously applied but did not get in, Ashley can also give you tips on how to improve your factor points. To make an appointment with Ashley, email her at ablake@olympic.edu. Hope to see you soon. Bye.